Okay, welcome everyone. We'll give everyone a couple of minutes to get on here. As you're getting on, I just want to thank you for joining us today. We're very excited that you've decided to take probably what is a nice Wednesday afternoon and spend it with us. If you're watching this remotely, then you will have a way to be able to ask questions to the panelists, or I should say, if you're watching this on YouTube recorded, you'll have a way to ask questions to the panelists through an email that we're going to give towards the end. So we hope that everyone has the opportunity to interact. As we're getting on here, this is the first of 3 webinars that we'll be doing. The second webinar will be on the 8th of July at 7 p.m. That's going to be more on returning to fitness centers, gyms, and clinics with an emphasis on what precautions need to be taken to return to those environments safely. That's definitely a webinar that's appropriate, not just for professionals in the field, but also for anyone that's considering returning to a gym, a fitness center, or a clinic. And then on August the 12th, Wednesday, August the 12th at 1 p.m., we'll also be doing a webinar related to allied health and COVID, specifically with the vulnerable populations, that being the elderly, the immunocompromised, people who might have a hard time coming back into our environments and working out and getting treatment from us, how we accommodate those populations. So we certainly hope that you join us for those other 2 webinars, and more information will be coming out on how to register for those in the coming weeks. With that said, I want to be respectful of everyone's time, and I want to get us going. We're going to be done promptly by 2 p.m. today, so we'll have everyone off by then. My name's Mike Stack. I am a 2004 alum of the School of Kinesiology. I'm also a clinical instructor in the Applied Exercise Science program. Myself, Joe, and Devaney from the School of Kinesiology collaborated on the idea for this webinar series on how to best accommodate this crazy pivot that the allied health industry has had to take as a result of COVID-19. And we're very excited to bring you this first one on the rapid pivot that we all had to make to virtual fitness and telehealth, because a number of us weren't doing that before. And I think all of us that are watching this certainly agree that health and healthcare is probably more important now than it ever has been, yet the ability to deliver those services has been significantly compromised by social distancing and all the complexities related to COVID. So with that said, we're super happy to have a panel with us today that's going to talk about this pivot to virtual fitness and telehealth in various aspects of our industry. We have physical therapy, we have corporate wellness, we have commercial fitness, and then we even have a business that's based primarily on virtual coaching and training. So we have definitely a wide mix of people. Since this is an hour long and we have 5 panelists, we're going to likely limit the amount of questions that all of you can ask during the webinar. Certainly, you can use the Q&A feature to ask those questions. And if we can't get to them during, then we will have a mechanism to follow up with those afterwards, and I'll touch on that towards the end of the webinar. But without any further ado, I'd like to take the opportunity to introduce our panelists. They're going to tell us who they are, what they do, and kind of who they're with, and then we'll launch into some questions that we've gotten from you, as well as some questions that we've pre-populated. We'll start with Val, since she's in the upper left. Val, why don't you introduce yourself and tell us who you're with and what you do?
Great. Thank you so much, Mike, for organizing this. It's just an honor to be a part of this group of panelists today. And also a shout out to AFS for keeping us moving all through this pandemic. I think you've just done an amazing job. My name is Val Macpherson. I'm a physical therapist at MedSport and part of Michigan Medicine. And I enjoy being treating clinicians, seeing patients, and I also coordinate the clinical education program, bringing in a lot of our students into our facilities. MedSport, we have 4 clinics. We have 2 clinics in Ann Arbor, one at Domino's Farms and one in the South End at the Ann Arbor Ice Cube. And then we spread out of Ann Arbor into Northville and in Brighton. And our team, I'm very proud of, the people I work with. We have a team of PTs, PT assistants, athletic trainers, rehab techs, and also working very closely with our orthopedic faculty. And our job, we love what we do in helping athletes from all ages get back in their game. And, you know, this has been a stressful time. It's been a challenging time for us in healthcare. And we are, you know, there are silver linings in coming through pandemics. And we are right now excited about opening up our clinics. We're getting back to seeing patients live in the clinic, and also seeing our MedSport fam of our clinicians back working together. So there has been challenges. We've got new norms. We're, you know, coming out of a pandemic, but we're still in this pandemic, correct? So we've got to address safety and safety for patients and safety for staff with new norms of, you know, PPEs, screening, social distancing. So we kind of social distance. We social distance now in the clinic, and now we've introduced this virtual telehealth. And again, I've been doing telehealth for the past 3 months. It's been fantastic, and it's been my honor to be here today to share the Michigan medicine and MedSport perspective.
Awesome, that's great. So Val, from very much a clinical PT setting, and then Rachael, more of a private practice-based PT. So why don't you tell us a little bit about yourself, Rachael?
Thank you. And thank you so much for having me. I'm really excited to be a part of this amazing panel and talk about telehealth, because I think it is such an awesome platform for people to be able to use. And it's, unfortunately, COVID has kind of catapulted us into this new environment, but I'm really excited to be able to share why I love it and how much fun it is. So I am Dr. Rachael. I am a pelvic health and obstetrics physical therapist, as well as a certified women's health and nutrition coach. I help women find joy and excitement rather than fear with the entire process of becoming a mama. My practice focuses mainly on health and wellness, but also on rehabilitation for women in fertility, pregnancy, birth, and in postpartum life. In addition to being a therapist and health coach, I'm also a mom of 5 children. And from just my personal and professional experience, I have learned firsthand that each mama's journey is unique, and that they have so many skills and tools in their own power to bring forth this healthy birth and recovery for both them and their babies. So what I do as a provider is offer guidance, solutions, support to help uncover these skills during this time of uncertainty, whether that's COVID or whether it's motherhood. So I'm just really thankful to be here today and appreciate you having me on.
Yeah, certainly the prospect of being pregnant and giving birth during COVID is definitely another challenge entirely. Yeah.
It is definitely a challenge for a lot of the ladies that I'm seeing. Mm-hmm.
So shifting gears into more of the corporate wellness spectrum, we'll throw it over to Amy. Amy, why don't you tell us a little bit about yourself?
Well, good afternoon, and Mike, yes, thank you for the invite to join this awesome panel discussion. I am Amy Ritsema. I work and co-own a company called OnSite Wellness. We're actually based out of the Grand Rapids area, but we do service businesses around the state and around the country, actually. Really helping companies to bring wellness solutions that fit their organization. And so this has been an interesting time when you're working with several different businesses, because every business is handling COVID a little bit differently. They're also handling the return to work differently. And so I think our biggest challenge moving forward is how do we meet the needs of all of these different businesses that we're working with, similar to individuals, but we're looking at entities, right? And how do we continue to service folks and getting them the health and the wellness solutions that they need and the programs as time moves forward. So I'm really looking forward to the conversation as we keep going.
Awesome. Now kind of moving over into the commercial fitness space, throw it over to Scott. Scott,
great.
Go ahead.
Thanks, Mike. Appreciate it. So I am the area developer for Orangetheory Fitness for the state of Michigan. We've got 22 locations in the state. I own 8 in the Metro Detroit area. We've been closed since March 16th. Fortunately, we're part of a large franchise network. We have 1,200 locations in the country. And with a really strong franchisor, we were able to pivot very quickly into online, we call them at-home workouts, which has been free for anybody, for the public, whether you're a member or not a member. We've had millions and millions of downloads and watches of those videos. So it's been a huge success, and it sort of forced us into looking at something maybe we wouldn't have otherwise. And now the strategy is to find how we can utilize the at-home workouts and now supplement with our in-studio workouts when the governor allows us to open. We understand it'll be a little different capacity-wise, safety precautions, things like that, but also excited to be part of the panel, so thank you.
Yeah, certainly. You bring up a good point there, Scott. I think the expectation of the fitness consumer has changed, and it's not just going to be the in-facility experience anymore that's going to be part of the value proposition. It's also going to be part of what they can do at home. So definitely excited to hear what you have to add. Last but certainly not least, Nick, whose business has centered around doing a lot of remote coaching and education and things like that. Nick, why don't you go ahead and tell us about yourself?
Thank you so much for having me on. It's an honor to be here, and go blue, of course. So I actually am very fortunate in listening to everyone else talk. We have been uniquely positioned where everything we do is remote and online based. So we haven't had to pivot a ton, but at the same time, we have had to pivot a little bit. And so we specialize in creating online diet and training programs for really folks of all different walks of life. And so one of the main things that we did is most of our programs are set up for people to be training in gyms or at home. And so we had to pivot a little bit, and we actually had an at-home program that we had before. It wasn't that popular. And then of course, once March hit, it became arguably our top seller. So we have had to pivot a little bit, but it's been really interesting, and we've always been remote based. So all of our employees and consultants are used to working from home. So that hasn't all changed too much. So yeah, I think we've been really lucky on that front. And again, just excited to be here and join the conversation.
Awesome. Yeah. And Nick, as I said, I know a lot of us are big fans of you and Mike and everything that Renaissance Periodization does. So we're definitely happy to have you guys as a part of this. Well, I appreciate the introduction from everyone. Now that we have some context for what everyone does, we're going to kick it to the first question, which is kind of a large catch-all question. So my apologies for being somewhat vague to try to get as much information in the room as possible. But we'll start again with Val, and the question is, were you doing any telehealth or virtual fitness prior to this? If you were, how did it change? If you weren't, what did you do? Like, how did you make this happen in such a short period of time? Val, what was the MedSport approach?
Yeah, great. We, between our 4 clinics and before COVID hit, no, we were not doing any telehealth visits. This is something in our vision of mission that we'd always kind of had on our horizon to potentially start. We work within a bit in electronic medical records, so we have a lot of information at our fingertips. And boy, this is something that's been on our goal and mission. When this struck, we just took a leap off the diving board, and it's again the team effort of a lot of people putting together templates, developing the virtual visit within a physical therapy visit, and training our staff. So no, we have not done any. We have gone from 0, and to today we have done over 2,500.
Wow! And what platform are you guys using to do your virtual business? And maybe give us just a little bit of that structure so people can understand.
We use the electronic medical record, a company through Epic. It's a pretty big platform for electronic medical records. So this has the capability of the virtual visit through Epic. So patients are put on our schedules, they're pre-arrived, they're pre-approved, they go through their insurance, and then we've been trained, and then there's a video capability on Epic that we arrive and see our patient on this secure platform through Epic. Now in the early stages too, we have the secure platform of, if they're having difficulty getting on the portal, there's a portal that patients sign on, and for some people that could be a little challenging. So we found that we've emailed and gone through the Zoom platform as well if they can't manage getting into the Epic platform.
Right. And I mean, obviously Epic has a degree of HIPAA compliance.
Yes.
That allows it to be secure. I'm just one short follow-up. I mean, what has been the talk around if you do need to use Zoom, how does that relate to HIPAA compliance?
Yeah, well, the Zoom platform that we use is Michigan Zoom platform, so it is compliant and secure. And so we always go through the Michigan platform. And then on the back end, obviously, patients are being aware that they're going on a virtual visit. They've approved for that. And so whatever platform we're using, it's a Michigan Blue Jean.
Yeah.
Zoom, but our number one is through our processes of workflow through the Epic system.
Awesome. Okay, so kind of self-contained. That's great. Rachel, how about you? I mean, this is something that you've been doing for a little while before this, I think, and now this caused you to have to make the pivot. Tell us a little bit more about how this worked for you.
Yeah. So as a health and nutrition coach, it's the only way that I work as a coach. So we either do phone conversations if they just can't access a virtual platform or need to take their call while they're in the car or something. And so I've used that for them, but then for my physical therapy clients or even just like wellness physical therapy clients, we've used a Zoom platform. I've used a Google, I'm losing the name of it, Chats platform as well. And it's just been a very awesome way to be able to access clients that may be too far away to come and see me in the clinic. Naturally, I work with moms. And so if they're unable to drive, or maybe they just had a baby, but they need something to be able to help them, it's been just a fantastic platform to, jump on and be able to help them right away. So I've really enjoyed it the last few years that I've been doing it.
What's your biggest challenge that you find between doing the in-person physical therapy and doing something over Zoom?
Yeah. So I think the challenge is more from the consumer's perspective too. Like, I'm sure you understand, Val, like people just think that they need the hands-on therapy in order to get better, when in actuality, there are so many things that we can teach you. Maybe we can teach their partner how to do some things, exercises, even, massage, trigger point release. So I think the challenge that I see is just talking to people about, yes, like we can get you started. If there is no other option for you to come in right now, then let's get you started by, helping your partner or helping you learn how to do some rehab on your own. So that's what I think is my greatest challenge.
Yeah, great.
Mm-hmm.
Now, Amy, as you said earlier, I mean, you work with companies, and we have a mutual client that we work with. We both work with Bank of Ann Arbor, and Jim Miller and his team are amazing over there. But this is quite a challenge in the corporate wellness space. So how have you guys accommodated this?
So, we had always had a platform, so a wellness platform where we could put online programs and that kind of thing. We've had that for a while. Fortunately for us, we switched platforms last fall into a more robust platform than we had before, which was a blessing in disguise, right? You never like to change platforms because you're always like freaked out about that, right? We're moving all of our clients to a whole new wellness portal. And by doing that, it truly allowed us to continue a vast majority of our services, just simply to moving online. It wasn't a difficult transition because we had that online platform, but the name of our company is OnSite Wellness. And so we are big fans and big proponents of being on-site, on location at those organizations, teaching classes, educating employees, doing wellness coaching, those types of things on site. So that obviously ended, right, very quickly. And so there was some transition in it. Being with companies, again, it was very dependent on the company and how they wanted to respond to this, right? So there were some groups that moved from in-person coaching to telephonic coaching. I think our biggest challenge with virtual coaching was we were not confident in the HIPAA compliance of Zoom and some of these other things. And so we really just went to telephonic at this point with the coaching. Which is something we do anyway. So it was just transferring people into that. But on the flip side of that, it is kind of pushing that telehealth side right now that people are more comfortable with telehealth, as most of them have been forced to use it for one thing or another, whether it was mental health, counselor visits or physical therapy or their physician. I mean, everybody was kind of forced to that method of seeing their physician or primary care. We are now looking at, is that a platform that we want to move forward with? And have that as an additional option as we move forward, because quite honestly, I think the challenge, there's multiple challenges when you talk about businesses. We have clients who are completely remote and are saying, we're not going back. We don't know when we're going back to the office, right? We have clients that are manufacturing based where the manufacturing people are back, but the office people are not. And then we have other clients who are all back. That have been essential, since day one. And so that's the challenge, right? How do you meet their needs, everybody's needs in a different way? And so that's kind of been our challenge of meeting the needs where they are. And we always used to say that, and Nick, I'll pick on you if you do wellness coaching, or Rachel, it's like, where are you today? How can I help you today? Mm-hmm. But we're now talking about where are you physically? Are you home? Are you in an office? Are you somewhere in between? Or sometimes, so there's a lot of new nuances that we need to think about with these solutions and how to help them. So,
yeah, certainly a lot of considerations to hold in your head as you're implementing this change. I'm curious, Amy, with all the companies you work with and the vast variety of organizations, how many of your companies have stayed engaged during this process? Just maybe on a percentage basis.
Vast majority. Vast majority.
That's
most of our clients who have full wellness solutions in place all stayed engaged in one way, shape, or form. We may have just not gone on site. We do have some clients that we may only do cholesterol screenings on site. Obviously that didn't happen, right? We could not go back to doing that. We're just now starting to get back into that arena. But, so those clients, the ones that were just screening clients, obviously we did not, some of them moved their screenings to later this fall. Some said, we're just skipping 2020 altogether. But the ones who had full programs, we had 0, I think, that said, no, we're done. We had some that were going to start that postponed, which is totally understandable. So.
And what are you seeing as the most popular service that is being used right now by those companies?
Probably right now we're getting a lot of requests and we're trying to give more information around the mental health side of things, anxiety, mental health. Especially I think right now what we're trying to talk to our clients about is returning to work. Not everybody is super excited to return to work, right? There's a lot of anxiety around that, a lot of anxiety about being around people. It's, how comfortable are you? How not comfortable? So I would say the mental health, and then really trying to encourage our clients to continue to encourage activity. I mean, if nothing else, from a stress management, we really, so we're really encouraging some activity challenges and some things that these clients and these companies we can push out to their employees to help them as they transition with their stress and anxiety levels.
Awesome. And I'm so happy you mentioned mental health. I think that's kind of gone on the back burner during this whole, very, physical illness of a pandemic. And I think, even though the majority of us on this call are exercise and or rehabilitation professionals, I think being able to partner with people in mental health is so important because it gets outside of our scope of practice so quickly, but influences things that we all do so dramatically. And I know that's part of what you guys offer at OnSite, but for everyone watching, that's something I just encourage is find good mental health professionals that you could refer out to, because that's such a important collaborative adjunct to the things we do from a physical wellness standpoint.
Right. And we, it was fun because we were able to, looking at Scott and Orangetheory and all these folks who ended up putting all these exercise, programs online, we were able to refer a lot of our clients because we had people asking, where can I go? How can I do my workouts? And so really did a lot of research around who was offering online programs for those people who were looking for those classes. So a lot of referencing, go here, check this, go to the call map, do this, just being a resource for people and finding that information that they need.
Yeah, absolutely. Definitely a time for collaboration. Scott, I mean, Orangetheory obviously has, vast resources of being a large franchise organization. I know that I and probably many people have seen some of the stuff that you guys have done. Were you doing any virtual fitness before this, and kind of what was that transition like for Orangetheory?
Yeah, it's a great question. It had been talked about, I think literally within a matter of 5 days, corporate down in Boca produced their first at-home workout, and it evolved from the first one. I think our average watch time was about 7 minutes in the beginning, and it ended up at our peak, I think about 22 minutes out of the 30 or 35-minute workout. And it started out with the basics, and then the technology added really quickly. I think the first or second workout, we asked, participants to use whatever they had in their house, because not everybody has weights. So literally there's a guided workout of someone using a baby to lift in lieu of weights, or paint cans or water jugs, or corporate really did a great job of changing the paradigm very quickly and jumping on it, producing a really, really high quality at-home workout with graphics and the video. And I think that really is the biggest challenge for it. You see so many at-home workouts, and the quality of it, I'm not sure is it worth doing if it's not going to be a good quality. Fortunately, we have a great franchisor that had the manpower to do it very quickly. So to answer your question, we did not do it before, and quickly pivoted.
Yeah, and I'm in a similar space to Scott with my business, and we had never done a virtual workout before, and at Monday, the 15th of March at about 3 o'clock, we're like, boy, we should figure out how to do this. And by Tuesday at noon, we were doing it. And I think that's kind of how we all reacted to this. One thing I do want to highlight that Scott says, I think the quality is important, and it's probably a little beyond the scope of this webinar today to talk about videography and production value and things like that. But I mean, those are things that you don't need the vast resources of Orangetheory just to pull off. I mean, my company is, 3 facilities compared to the 1,200 that Orangetheory has. And with only a very small investment in some lights and a nice DSLR camera and a simple editing software and a little bit of effort, you could put out a reasonably high quality workout without having to spend a lot of money. And for those of you that are watching that are kind of the sole proprietors or individual entrepreneurs, that's certainly something that I think is viable for you. And I think the consumer is going to have that expectation because, beyond what just Orangetheory offers, there's obviously Beachbody and Peloton. You go down the list, there's a lot of high quality options out there. So I don't think you have to be resigned to the fact that, oh, I can't do a high quality virtual workout because I don't have vast resources. I think it's as the big companies like Orangetheory have found, a smaller company like mine has found, the investment that you make, I think will pay dividends for the long term, because I think all of us on this call can agree, virtual fitness and telehealth isn't going anywhere. Like, this is something that's going to exist in the future. Yeah. Now, Nick, you guys at Renaissance Periodization, you guys have been a remote coaching business since its inception. And like you said, you had a little bit of a pivot, but not a huge one. Tell us about kind of that process for you, and maybe what's been unique since COVID and the shift that you guys are making.
Yeah, thank you. So again, everything we did was really online already, but it wasn't necessarily focused on people training at home. And so we had a female at-home training program, but we didn't have a male version. And very quickly, the demand, skyrocketed for that. So we had planned on doing it later this summer, and it was sort of like we had to quickly pivot and make this actually becomes the #1 priority now. And so we were able to get it out, I think, pretty early in April. And again, it's just been a real big hit. And I think, like Scott said, we had professional video person help us with it. So I had high quality videos with it, and it's just a nice looking PDF, and you can sort of go through it as the weeks progress. And it's just been really good overall. We also, we have our own podcast, we have our own YouTube channel, it was really just creating content around that. So again, with the podcast, it's pretty easy. We just started doing some bonus episodes about COVID and, how do you deal with that? Wrote some blog posts all about it, because that's what was on everyone's mind. As soon as the middle of March hit, we were like, all right, well, this is not going away. Like, we need to address it. And, we have the experts to do it. And so we created the content around it. I think people were really appreciative of that.
Yeah. And I think that's an important point. I think we've all seen the commitment to creating content on a consistent basis, I think, is so important. And that's what, all of us are doing to varying degrees. And I think that's great. Now, Nick, I'm curious with what RP does. It seems like your demographic tends to lean more towards the higher intensity exerciser in some cases, the strength athlete, maybe the physique athlete. How did you guys accommodate the lack of home-based equipment? It's one thing for me to tell a 55-year-old woman to just use your baby or your milk jug, but to tell the average CrossFitter that they need to do a split jerk with a gallon of milk seems like that wouldn't be super effective. So how did you guys address that?
Yeah, that's a really good question. It seems like fitness equipment was about impossible to come by the end of March. Yeah. Like, forget about it. And so, actually, like on our Instagram Live, one of our workers was doing videos, using milk jugs, using books to kind of show people, like, you don't actually need really fancy equipment. And I think part of the process is also educating people that, hey, guess what? You're not probably going to have a barbell in your living room unless you're super, super serious. So maybe you have a pair of dumbbells. They're going to be light. That's okay. You're going to be doing a lot more reps. You're going to be doing shorter rest breaks, just cramming the intensity, because you don't have all the things that you normally would. So you have to be able to change and adapt. And again, helping educate people on that. And it's totally fine. For the people that are a bit more serious, they were very concerned that, hey, if I can't train for 3 months, I'm going to lose all my muscle, lose all my strength. Like, no, pump the brakes. It's not the end of the world. You can still train really hard. And as long as you're consistent, you might actually train a little bit more often, because instead of going to the gym for an hour or 2 hours, you're only working out for 20 or 30 minutes a day. So just helping educate people on that, I think, was really big for us.
Yeah. So it sounds like part of your shift was maybe away from the pure strength and power-based programming necessarily, and shifting more towards metabolic conditioning and maybe the higher rep spectrum for hypertrophy training in some cases.
Totally. It had to be.
Yeah, absolutely. I'm curious for you, Nick, since you work with clients individually, and maybe this could be, this actually could be for any number of us. Scott, I think you're more in the business development end than the operations end, but how do we keep people accountable during this? Like, Nick, how are you holding your clients accountable to their programs and doing their exercise right now? How's that differed from maybe when people were getting in the gyms, if at all?
Yeah, it's maybe a little more challenging. And I think, as was mentioned earlier, just the mental health component, you just have to be a lot more empathetic towards that, because everything's just so stressful right now. You just sort of have to tell people that, you know what, you're not going to be perfect. No one's going to be perfect. You might, eat more than you should, or you might miss a couple days of working out. Like, that's going to happen, right? Like, we've never seen anything like this happen as long as probably any of us have been alive. So again, it's just stressing to people that consistency is more important than perfection. So you don't have to be so worried about being 100% every single day. It's, you have to account for major life stressors. And this is probably the biggest one we've ever seen. 2020 has just been pure garbage. Let's be honest. It's been a terrible year, I think, across the board. So again, just helping educate people on that, you know what, you're not going to be perfect, and don't stress out too much about it, because we already have all this other stress going on.
Yeah, absolutely. Like Amy, what are your coaches seeing at OnSite in terms of accountability and motivation and just maintaining consistency?
Yeah, we really tried to do a lot more communication with our clients and through our portal to the employees as best we could. We actually saw some increase in some of our portal usage because people were looking for answers, right? So, and we really tried to shift the content so it was relevant for, staying healthy during times of crisis and some of that type of thing. We did end up doing some live webinars, which we had never done before, and offered those across the board to all of our clients. And we did one on nutrition and one on activity, and the activity one really was, how do you squeeze in 10 minutes of activity? It wasn't like, that whole thing, because I think we had to have a lot of conversations about giving yourself grace. I mean, Nick, you kind of said that. It's like, you may not feel it today, and that's going to be okay. If your mental health needs your attention, then deal with your mental health and not worry about all, getting in your 60-minute workout. Sometimes a walk around the block is all that you're going to get, and that's okay.
Yeah.
So messaging, a lot of it, and just messaging this stuff.
Yeah, it sounds like, going back to that mental health component, such a big part of this. Scott, what are you hearing from some of your coaches at Orangetheory in terms of how they're keeping their clients motivated and accountable?
Yeah, what we found the first week or so of the pandemic, everyone was in shock, really, and did not do a lot. We took that time. We had most of our staff still working. We literally called every one of our members personally and checked in with them. How you doing? How you feeling? You holding up? Make sure you're doing those workouts. We then introduced them to the online platform. We also started conducting some Zoom workouts with the coach so they could join their 5 a.m. crew that they're used to. We find that the community aspect really started to help motivate members. We started doing, we called it coffees with coaches. So they would just 3 o'clock in the afternoon, they would all have coffee on a Zoom call, and it was people that they knew, and they could exchange ideas and just talk about their lives, not really working out, but just connecting. And we also engaged a nutritionist, and we ran 8 free nutrition seminars for members and their friends and family. So I think Amy really hit on it, that you just do a little by little. I think people really appreciated the in-person phone calls and not just the text messages or the emails. I think people really needed to hear from their coaches or from staff who they knew and trusted.
I think one other common theme here that's coming up is just that connection, trying to make that human connection in such a difficult time to actually make those connections. That's great. Rachael, what about you in terms of trying to hold your patients and clients accountable during this period of time? How did you approach that?
Yeah, so I think that's just very individualized on the person, the mom, and where she's at in her journey. A lot of times it's really just bringing in some of those coaching skills of just mindful listening to the client, listening to what they're saying, talking through what has worked in the past for you. Is there a good time of day? Do you have support of somebody else in the home to, be with your children so that you can get some a workout time in. And so, like I said, it seemed to just be very individualized, and just listening to, what that client is telling me and working through that process with her and to get her moving. So.
Yeah, and that social support element, I think, is so huge. I mean, one thing that we've all seen during this is our house is now our gym, is now our workspace. It's our world has shrunk to a great degree, and you don't have all those habitual cues of getting in your car and going to the gym, and there's no space between, where you were working, where your kids are, where you're eating, and where you're working out. And I think having that strong social support to say, hey, honey, can you take the kids so I don't have, my 5-year-old hanging on my leg during a squat? I think that's a huge point, and using those coaching skills. Now, Val, what about you guys with your orthopedic clients and patients? How have you kept them accountable, held them accountable? I mean, imagine some of the physical therapy work that you do. People aren't always super fired up to be coming to physical therapy. I think that I look at the people that go to Orangetheory, and I mean, they're strong advocates for that setting, and they're fired up and they love to be there. People aren't always super fired up to come in and rehab their ACL. So, I mean, you have a different stance. So how have you navigated that?
Well, not at MedSport. All our patients love coming to see us.
Sorry, I forgot.
We're fired up in the clinic and we want to make it fun, but it's true. We have found through this virtual world, I'm talking to a lot of the staff that have done a lot of visits. They've been so excited about the challenge of connecting and firing people up through the virtual visit. And, it's difficult because we have to extend our hands through the screen to say, okay, you're part of this evaluation with us. And the education component that we are giving to our patients is not that we don't do that in the clinic. That is a huge part of what we do in educating about conditions. But through the virtual visit, this platform, we can engage the patient to be part. Okay, put your finger. They're going through our evaluation with us. In the return of that, I think they're learning more about their injury, which in the end is motivate. Okay, yeah, I got to do that exercise, and I'm going to carry through with that. And so it really, it's not like we don't do that education component, but they become a much more part of the evaluation. And I think that is motivating. The patients are super appreciative of contacting them, and it has been a great platform, and moving forward, it will continue to be. So I think the education component really follows through into the compliance and, the motivation to keep on with their exercises. And you think of, if all our visits were in the clinic as we were in pre-COVID, the compliance of, getting on in a commute and getting in a traffic jam and not making it to the clinic, this platform is like, it's convenient. Patients like it. Everyone's time is busy. It eliminates for a lot of patients 2 hours of their day potentially with traffic and, construction. So I think compliance and no-shows, there are a lot of benefits. And
I think you brought up a really important point there of actively engaging the patient in the learning process and how empowering that can be. And I can imagine, like, you're not there to put your hand on someone's tibial tuberosity and see how that's feeling, and you actually have to engage the patient in that. And I think that's great, and I do think it allows them to take a little bit more ownership of the process. That's awesome. Well, we've got about 18 minutes or so left. There's a couple of big questions that I want to get through, so we'll try to plow through these. The next one, and let's keep this answer brief just so we can get to the kind of take-home message from all this. But I guess we'll kind of go almost in the order that we just went, starting with Nick. How do you guys monetize this? A, and then B, for those of you that weren't doing this before, how are you going to keep doing some of these things? Is it going to change? What's going to happen? So I guess the two-part question is, how do you make money on this, first part, and then are you going to keep trying to make money through this virtual realm even when we start to get back into the gyms and fitness centers? Nick, why don't you talk about kind of RP's model for doing this?
Yeah, we're going to keep doing what we've always been doing. So again, we're very fortunate on that part. Again, sort of we pivoted to the more gym-free programs. And again, now as people are maybe getting back to the gym, it'll go back to the more normal training programs that we have. But also, like, we have an app, so we have a diet coaching app, and so people can still use that. And I think we've actually seen a little increase because people are a bit more aware of, hey, I can't go and work out as much. Like, I probably need to watch what I'm eating more. And so, I think there's been an increase on that regard. And so we're just going to keep doing what we've always been doing, and just obviously keep on working on improving, listening to feedback, and keep getting better over time.
Scott, what about Orangetheory? How are you guys going to handle this, both in terms of the continuation of the virtual workouts and potentially monetizing it? Because I believe at this point, you guys aren't charging anyone for the workouts.
Yeah, we're not charging, and you don't even have to be a member to use it. That will continue. I think in the near future, there might be an expansion of the virtual workout into something more robust, which would be part of the membership. But I do see some form of virtual workout being free, and being able to monetize it, as I mentioned, through lead generation. Hopefully get that person who's at home, maybe they're afraid to come into the studio or don't know what the studio experience is like. Once they do the at-home workout a few times, then all of a sudden we bring them into the studio and monetize through membership.
Yeah, and that's such a great point. And I think not being short-sighted is very important. And I think that, right now, the ability that, at least in commercial fitness, we have to be able to open up the hood and let people see into our facilities when they might not otherwise be able to come in there, I think is really important. And it definitely is an opportunity to give, and then after you give enough, eventually you're going to receive. I mean, I know Nick, you guys with RP, you guys put out a ton of free content, and you've really built yourself as authority figures in the domain. And Orangetheory is doing this very much the same thing by providing this, building some credibility, and then that just naturally leads to conversions, even when you're not actively seeking them. So I think that's such a great point.
And Mike, I mean, I think there's an opportunity down the road to build some at-home workout equipment packages and monetize through that way. If we create the workout and deliver the workout equipment that people will need to do those workouts, there's an opportunity to sell that equipment to folks at home.
Yeah, and I'd be lying to you if we in my company haven't considered how we can't get equipment at wholesale and then retail it with programs. I mean, certainly the shortage of equipment that existed at the beginning of this definitely got everyone thinking about, man, if I was retailing exercise equipment right now, I'd have a chance to make up for some of this lost revenue. Amy, what about you guys? I mean, it sounds like some of this is going to continue. What's the general thought?
Yeah, I think for us, we had an opportunity where we could have jumped on some things and made some money on it. And I didn't feel right about it. I'm going to be honest. It's like, I'm not going to take advantage of people. I have a lot of people ask me, are you going to get into COVID testing? Are you going to get into antibody testing? And I'm like, it's not really in my wheelhouse. But what I will tell you is, I've been having a lot of conversations with other organizations and going back to that collaborative effort. And, my hope is that I can partner with some other organizations that might have services that I'm not offering. And and it becomes more of a, how do we work together? If you're going to stay in this lane and I'm going to stay in this lane, how do we do more reference marketing, shared marketing, some of that stuff where maybe we can build our client base. And I think similar to, just being that expert in a time of crisis and hoping that by delivering really great programs for our existing clients, that the word of mouth of, hey, they did a great job during this time, you should check them out. That's kind of just where we're at right now.
Yeah, it seems like the organizations that have really focused on serving and being there for the marketplace are looked upon as very favorably, and I think they'll reap the rewards of that on the back end. And I think you've seen that across many industries. Rachael, I mean, this is kind of part of your business model and things like that. And maybe for you, it might also be good for you to speak to directly how you monetize some of this stuff, as kind of a private practice PT and wellness coach.
Yeah. So I am a cash-based physical therapist, which means I don't work with insurance companies, but I will provide my clients with what we call a super bill, so they could submit that to their out-of-network deductible. I also accept health and flex spending accounts as well. From the coaching perspective, I mean, not that I'm aware of insurance companies cover coaching at this point, but again, I can, take the health and the flex spending accounts for my clients. So I will definitely be continuing to offer the telehealth services. It's just been a part of my practice for several years. I am back in the clinic right now, so I do have that option for in-person. I do have some clients who may do in-person and telehealth. So I'm very almost like an a la carte therapist and coach, in that I help my clients kind of design the program that they want. Do they want a few visits in pregnancy, and then maybe we save a couple for postpartum? So, and that comes in the sense that I offer several package options. I do also offer session to session options, but what I find is that clients really do, in order to kind of have that accountability to see some improvement, having somewhat of a package program is helpful for them, so that they can, continue to improve and to have me there to support them to build onto a program at each visit that they have. So
Great. And Val, what's MedSport's plan? I mean, are they going to continue in the telehealth space, and kind of and is that being reimbursed at the standard rates of normal in-clinic visits?
Yeah. Through this, they launched through the insurance companies. Most insurance companies for physical therapy is a covered expense. Prior to COVID, it was not. So this is, just a great, advantage. Number one, we're wanting to take care of our patients. It's, getting reimbursed through insurance is an awesome, and we hope that, that will continue on long through this and past, because there's so many benefits to it. So from insurance companies, it is now a covered benefit for virtual visits for physical therapy. And, yes, we're looking at, incorporating virtual visits long-term into our program. And, again, as what Rachael says, it could be a combination of in-person care to the virtual visit. And, again, some patients will love that in-clinic experience, where other patients are kind of nervous about going into the clinic, and it's kind of awkward doing exercise. So we're capturing, a group of patients that really are going to thrive more in virtual visits. And you think of our footprint. We're very active right here in Southeast Michigan, but what about that Sheboygan person who lives in Sheboygan, a runner who needs our services? Why not? Why couldn't we connect with those patients from afar? So we're excited that it's going to expand our footprint and be part of our landscape.
Yeah, that's such a great point. I mean, I know, Nick and Renaissance Periodization, I'm sure you work with clients around the world, which if you were just a personal trainer working in a gym in North Carolina or Florida, you're limited to the 10 minutes around your facility. So that's a great point, Val. Well, guys, we're going to popcorn it around for one last question, kind of as a take-home message for everyone. And I guess the general question is, what's your advice to the people that are watching this that are just doing this for the first time, just getting into this? Speak to, talk to, and teach on the best practices in the space that you're in to best accommodate our clients and our patients. I guess we'll start with Val, and then we'll work our way around. Val, if you can give a quick short summary of what you think are those best practices for PTs to consider. What are they from your perspective?
Yeah, just being open to change. One thing, MedSport Michigan Medicine, we've been open to change, and we're kind of learning along as we go. I don't consider myself an expert, but I'm open to improve and learning from my colleagues. They're sharing great things all the time. I think you just keep it simple. Be in Nick and everyone here on the panel, we don't need a ton of equipment to make it effective, but it's got to be, less distractions around you, being in a professional environment, an opportunity to educate, just having a few pieces of equipment so that you can demonstrate, and then there's a follow-up to, to form and seeing them in the next week or in a couple weeks. So it's a loaded question, Mike. There's so many things. I think have it, don't overthink it, have fun with it. And I think as you get on with patients, they're so appreciative, and you're making it effective, you're educating, you're making them accountable, and you're just trying to get them better and be a part of it.
I think the first thing you said there was so important. Keep learning, keep evolving. Yeah. I mean, if you look at where things were at before this whole thing started to where we're at now with the quality of these virtual fitness and telehealth, it's tremendous. Rachael, what about you? What's your advice for people that are implementing these kinds of things?
Yeah, I love what Val said, because I actually wrote in big bold letters, keep it simple. So when you're working with clients, maybe you're just giving them 1 to 3 things to work on. So they're not overwhelmed. You're, like she said, you're going to be educating. I actually on this question wrote a ton of stuff. So I'm going to very quickly summarize it for you, because I found it for myself to just be so helpful. But things when you might not think about when doing telehealth is maybe having some kind of consent form available for your client. And in that, it's giving them consent for them to work with you, but you go through kind of a little checklist of things that they can be prepared for. So things like check your connections ahead of time, maybe having one device streaming at a time as opposed to multiple devices streaming. Consider having a booster. And then just developing some rapport with that client to keep them comfortable by having this. So other things that I have in my consent form are, what should you wear when you're doing this? Because just even in-person physical therapy, sometimes people come in with high heels on and a skirt, and I can't do a lot. So, telling them, what should I wear? Do I need space for this? Is there proper lighting so that I can see them to do an effective evaluation or teach them how to do an exercise? And then, maybe ahead of time, if they, don't have access to all this equipment that we have a shortage of, what equipment can they have? What types of things could you use for what they're planning for their session? I also think it's helpful to potentially tell clients to have a cell phone or a tablet as opposed to their computer. I mean, if they only have a computer, then that's fine, and we will work with what they have. But if they have some kind of cell phone or tablet, it's a lot easier because then they can move it around, especially if they need to go to a different space. Having maybe a partner or somebody that's there with them to help them hold the camera so that we can see. You can go to Amazon and get like inexpensive like tripods to hold your camera too. I know there was a question about people that may have some disabilities. So, working with different types of equipment to be able to help people be successful in those sessions. Let me see if I wrote down anything else. One other thing is just, and I don't know if this helps in an exercise physiologist perspective, but also having liability insurance to just cover yourself for these sessions as well. And just having clear policies with your clients as well on, what is, if you're not, an insurance-based practitioner, what are the fees for this? What are the no-shows or the cancellation policies, so that with this handout that you may give them, you're very clear on what your boundaries are and what you expect out of them, so that both of you can have this successful visit.
Awesome. Amy, how about you on your end? What's your?
Yeah, I'm going to say two things, and I'm going to take them more from business owner / entrepreneur advice. And I would say, don't be afraid to pivot, but pivot within your space potentially. But how do you just shift if necessary, and how do you do it quickly? And someone said this in a webinar early on during COVID, and it just kind of stuck with me. And I keep asking myself, and I'm challenging my team with it. And that is, what can you let go of? And what do you absolutely have to keep? And if you think about things in that way, it's like it may help with the shifting and the pivoting. What things absolutely can we not get rid of? And what things can we let go of and do differently? So that would be my couple pieces of looking forward.
Yeah, that's great. I think every business right now has to scale appropriately to the resources they have in their top line revenue. And you can't, there are no sacred cows right now. We need to let the things go that just aren't going to work for our business.
Well, and in regards to everything, business, programming, all those things, so.
Absolutely. Scott, how about you guys?
Really two things. I think one is to, whatever you create, make sure you're consistent with it. I've seen a lot of, especially in the fitness world, they have one idea one week, don't do it for a few days, and then a new idea the next week. I think the public likes consistency, whatever that might be. And really to piggyback on Amy's comment, because I've used a term a lot with my team over the last 3 months, and some of you may or may not know it. If not, you can Google it. But I've said to them, don't jump the shark. Don't go. See, Amy knows, she's my age, and some of you know, but Google it. And it really, it's a great reference for my team, because some wanted to do things that really isn't in our wheelhouse. And all it would do is decrease the quality of what we do and what our brand is. And I think it's so true to stick to what you're good at. And just because you see someone down the street doing something doesn't mean you have to do it. You can still be your own brand and stay within your brand.
Yeah, I think that's a great point. I think there's this tendency to move towards what's new and shiny, and then you forget about the things that you're actually talented at, and you really dilute your brand in the process. Nick, how about you?
I would say embrace the change, because there's probably a good likelihood that this is going to stick around. People are now used to doing things virtually. And again, many of the panelists already said this, having the flexibility to do some of each, because people had never done this before. Well, now start doing it for a couple months. People are hesitant to go back in. It's going to be worthwhile to have flexibility and give people the options. If they want to come in, great. That's awesome. But if you don't, hey, we've now seen that it works. So just kind of get used to it, because it's probably not going away.
Yeah, I mean, I think those are great points. And this, Val and Rachel, you guys both mentioned that the hybrid of people coming in and people that do stuff virtually. And I think that, for some time that's going to be the case, particularly as the waves of the virus seem to undulate up and down as this time goes on.
Mhm.
Well, everyone, I want to thank you so much for joining us. Panelists, you were great. I mean, I'm sure we could talk for 5 hours on this with everything we've had to consider over the past 3 months. If any of the attendees do want to ask questions, we do have an email that you can send questions to any of the panelists, and we'll push that email to them. That email is Kines Questions, so that is KINES, and then the word questions at umich.edu. I saw Devaney just put it in the comments. So please feel free to send those questions to that email address, and then we'll pass them on to the panelists and then do our best to get that information back to you. But we hope you enjoyed this conversation today. And then again, please keep in mind on the 8th, of July, we're going to be doing a webinar and getting back in the fitness centers and clinics and what kind of the safety and mitigation protocols should be. And that's at 7 p.m. And then our last webinar of the series will be on the 12th of August at 1 p.m. Again, we'll be talking about working with the elderly and immunocompromised population. So we definitely hope you join us for those webinars. And I want to thank everyone, particularly our panelists, for joining us today. And everyone have a great day and stay safe and stay healthy.
Thank you.
Thank you.
Thanks, Mike.
Thank you.
Bye.
Thank you. Bye.